All right, so I'm going to go ahead and get started. I truly believe that we're in for a treat today. We're going to be talking about extended care and the different options that are available. And I will tell you, this is an area that in our practice here at Personal Wealth Strategies, we get an awful lot of questions about, mostly because people don't have experience and don't have knowledge of what all the different options are. It used to be that when someone needed care, it was a choice of being cared for at home or being cared for in a nursing home. And those are the only two choices. But today, there's so many different options available. In fact, most of the options are built around the idea of not going into a nursing home. The time to learn about these things is now, and not down the road when you have no time to make decisions. So rather than answer these questions ourselves, we brought in a national expert. Our presenter today is Nancy Dykeman. Nancy is president of Long-Term Care Planning Consultants, LLC. Now, early in her career, Nancy was a co-owner and served as a funeral director for her family-owned funeral service company in Northeast Iowa. Following that, Nancy began her executive career in 1985 as a marketing leader for an independent living and nursing home community. Nancy earned her license as a nursing home administrator in 1989, operating large luxury retirement communities, assisted living facilities, and nursing homes. Nancy has served as a caregiver for her mother for 20 years, her father for 5 years, her husband for several months, and for a daughter, a cancer survivor. So she comes with lots of experience in this area. She's recognized nationally as a premier educator in the long-term care field. She's been a core instructor for the Corporation for Long-Term Care Certification, or CLTC, since 2003, which is how I met Nancy, and is the former chairman of the board on the CLTC Board of Standards. She's also served as a faculty member of the Society of Certified Senior Advisors. Nancy was selected as a national presenter for the Women's Project for Long-Term Care and as a speaker for the federal government's long-term care program in 2001. She joined the largest long-term care insurance brokerage firm, LTCI Partners, as a senior client services associate in 2014 and works with consumers, financial advisors, and insurance companies providing training, and she's a top producer herself. Nancy's goal is to prepare families for the physical, emotional, and financial consequences of needing care or providing extended care. Now, in her free time, whenever that might be, Nancy is a professionally trained vocalist and stage actor in community theater. She's been a member of the Sea Isle Chorale since 2013. Nancy shared with us that her best gardening is in the early morning, and her best time to focus on work is at noon, going through the early evening hours. So we're catching her right at the beginning of her workday. Her granddaughters, Riley and Katrina, live next door to Nancy, and she's very included in their wonderful lives. Today, Nancy is once again a devoted caregiver, as her husband of 46 years, Chick, struggles with congestive heart failure. So without further ado, I present to you Nancy Dykeman, who will speak on choices when extended care is needed. Nancy?
Thank you so much, David. It's a pleasure to provide education on this important piece of planning. I'm going to just open up. Am I sharing my screen yet? There it is. Okay, you can see my screen okay, David?
Yes, we can.
Wonderful. The reason I'm in this industry is because I've been with families in chaos in funeral service when we owned our company for so many years in Iowa. And I watched families blow apart at that particular time. And then when I switched over to long-term care planning and consulting, I saw the same thing happening because they didn't have a plan. And most people don't have a plan. It doesn't mean that you have to fund the plan. It's just you have to talk about the plan and have a conversation. So what I'm going to give you today is just some of my thoughts and my experience, because I'm dealing with it myself right now, again, with my husband needing home care and me working and helping other friends and people who need guidance, because there's just not a lot of information out there. So we'll run through the slides and we'll have some questions at the end. So it is all about choice. It's about family. It's about choice. It's about where do we go? What do we do? Who do we talk to about this? And it's advancing. So my goal is to provide you with the knowledge and some experience before the chaos of needing care or providing care is right now. And it happens that fast. It can be a car accident, it can be a stroke, it can be a bad fall. So if you believe you're going to live a long life, most likely you will be either cared for or be a caregiver. I just guarantee that, because we can't get out of this life without taking care of other people. And the longer you live, the more chance you have that you're going to need care, or your friend might need care. Maybe it's you and you're just recovering from something, or you're living with a serious health issue and you have a new normal and you just don't know what to do. And making decisions when you don't feel good is not a good idea. That's not a good plan. And living into your 90s, it isn't that scary anymore. I've put a number on my life of 103. So I hope I feel like I do today when I'm 103. But think about your last breath when you think you might do that. But you just need to plan for it. We're living so much longer than our relatives did, and we need to prepare. I love this little family picture, because who needs the care in this picture? It doesn't necessarily mean grandma and grandpa. It could be the young father who needs care. It isn't all about elderly issues. It's the fact that we need care beyond our medical insurance. And how do you pay for that? And when care, extended care is what we call it, instead of nursing home care or long-term care, we've changed it to extended care in the past few years, because it really is. It's an extension of your regular health insurance and Medicare. Maybe the little boy needs the care. Who knows? We can't predict that. And so we need to be prepared all the way around and have a good conversation. I always say Thanksgiving is a great time when you're laying around in the afternoon and not wanting to go anywhere and do anything but rest, is to talk to each other and find out what you would want or what you would not want. So what do? This couple is a friend of mine, and Doug he's struggled with really bad health, and Anne has really taken care of him for about 3 years. And now he has dementia. He was diagnosed last week, and he's been hospitalized from a fall. And she called me and she said, what am I going to do? I can't take care of him at home. I don't know what agencies or organizations or facilities to call, and he'll be discharged from the hospital on Friday. The hospital was telling her she better find a place for him. And the discharge planner was nice, but she was recommending a skilled care and rehab and then assisted living, and he would never go home again. And of course, his goal is to go home. So what options did she have? And she didn't know where he should receive care, who would be with him, and what would pay for it. And that's what I do, and that's what David does. And Justin, we help people figure out what the plan is, and funding that plan comes later. Now, this is a picture. What does this make you think of? The nursing home. We're not really even talking about nursing homes anymore, because most of us will not ever go there. What we're talking about is staying out of the nursing home. And yet this is the level of care, and it's an important one for some people, but most people will not be going there. So we did, as David said, only have one choice until the mid-90s. And now we have a lot of choices you'll see today. Most people stay at home. About 80% of people getting long-term care today are home. And you do better at home because you're around people you know and love. And yes, they need rest. They need time off too. So that's where you would be hiring people from a home care agency or professionals. And it costs less because most of the care at home is provided by family. So you think about the family being with your spouse, you'd be with them, and so would the kids or grandkids part of the day or most of the day. And then you have a hired person from a home care agency come in and help you, or a good friend or neighbor. It's non-professional people as well as professional. And the professionals tend to do the more difficult tasks of bathing or dressing someone, helping them get through their day. And each of these slides, you're going to see what the staff includes. So informal is family and friends, non-professionals. And then the formal, go backwards. The formal is the paid people, and the national average monthly cost for only 5 hours a day. We're not talking about 24/7 care at home. That's more than a nursing home. But until the cost of care on these national averages for these levels of care got to be over about $2,000 a month, which it was when I was a nursing home administrator, we could take care of it without insurance or without any funding or even thought about it. And you didn't stay in a nursing home very long. Today, at $5,000 a month, and we expect that to keep growing in inflation, the cost of care is unaffordable. And that's why we have these conversations. It isn't all about the care, it's also about the financing of it. What is adult daycare? That is a supplement to home care because the caregivers get exhausted. Their health starts to fail. And so now what's going to happen? In adult daycare, most of the people that I've seen in adult daycare have dementia and can't be left home alone. But the wife needs to go to work, or she needs to go see the grandchildren, or go get her hair done, whatever. And so he would be dropped off in the morning and have all kinds of things happening: music, movies, exercises, group activities, food, rest, and different people each day. I mean, they don't always go every single day. It doesn't cost as much as other levels of care, and it's driven because the caregivers, the adult children are seeing mother getting so exhausted, she needs to take him somewhere during the day, but he can sleep at home at night. So that helps you to stay home longer. And the staff members are therapy professionals, aides, and volunteers, plus administration and marketing. That monthly cost is $16.90, but that's a lot of going and coming. So sometimes it's just a drop off point to get some rest. You'll get encouragement all along the way. If someone who needs care, if it's you or your spouse or an adult child, a grandchild, you need people. And I realized that when we used my husband's long-term care insurance policy 6 years ago with a bad back issue. And I just thought, I've got the money that I can buy the people. And you need people. You need friends, you need relatives, and you need a lot of encouragement. There are personal care homes, and some states are called residential care, or they're called group homes. Maybe you can think about some of this level of care from years ago in your hometown. Not every board and care or personal care home is licensed. It's a house, and maybe the daughter lives with the mother, and the mother does all the cooking and brings in other people, maybe 8 to 10 other women that have dementia can stay there. It's a big house. But if somebody isn't awake at night, that's a difficult situation, because most of these folks would be possibly wandering or dementia or need supervision, and you've got to have staff that are awake all night. So that's how they're licensed. They're private residences. Some communities have these homes and at costs similar to home care, and they have to have staff members awake. And it's a home-like feel of food and safety and security, all inclusive. And it's in a typical neighborhood. You might not know that somebody has a care house. Staff members are the homeowner, the paid aides, food service, volunteers, and the national average is $1,500 to $4,500 a month. Assisted living communities or residential communities, it's an apartment style. It's so much better than a room about the size of a big bathroom with one bed in it and one lamp and table and a small closet, which is a nursing home. This is not. This is like, think about the Marriott Courtyards or the Hilton Bridges, small hotels. Well, they even changed some of their small hotels into assisted living. It's that look and feel, and it includes everything. So it's a monthly rent, and a very minimal package of care, and then you buy more care as you need it. But you furnish it and you pay a monthly rental, and then there may be a special memory care wing that'll cost more because it's less people per staff member. And staff members are nurses to oversee care providers, aides, recreational therapy professionals, housekeepers, dining, marketing. The national average of that is $4,500 a month. And you think, well, maybe I could handle that for a while. Could you handle $4,500 a month for 2 years or 3 years? Because that's the average length of stay in assisted living, is 3 to 3.5 years. Men don't do as well. Women do much better. You'll see that the population is about 90% women and a few men. But it's such a relief to the family. The children drive that move. Mom doesn't want to move, but she can't take care of dad anymore. He needs more care, but he doesn't need to go to a nursing home, and they can stay together. Or she's by herself and now she needs to have help. So you buy more care as time goes on. The residents have everything they need. It's like a concierge service. You have everybody at your fingertips if you need it, but the care is not constant in your apartment. You pay for care for aides to come in and help you get up and bathed and dressed, maybe to breakfast, but they don't stay with you. They've got a lot of other residents, but it's a very desirable, attractive place. And I really recommend that each of these things that we're talking about, especially home care, talk to a home care agency person before you need to. Assisted living, you probably know there are some right around you in your town. And if you'll just go in and take a tour, and they'll probably offer you lunch, and they just want people to know what they do, because at the moment that the discharge planner at the hospital says he's got to go somewhere. And that's what Ann said. She was hoping that she would have time to go investigate things. So she asked me for recommendations. And I think as professionals in our industry, we should be prepared to make those kind of recommendations to folks like you. Memory care has really evolved. The longer people live, the more chance they have of having elder dementia. But it's really a loss of reasoning. It causes safety issues. People needing supervision are cared for by family for years before needing professional care. It doesn't come on quickly. Dementia comes on very slowly. Caregivers become exhausted and chronically ill themselves. People who need more attention are part of assisted living or nursing facilities, and staff members are RNs to supervise, specially trained aides, therapists, dining services, housekeepers. National average monthly cost is $11,500 a month. So think about, where would that money come from, and who would be with me at the time that I need care? It's all about a plan and a conversation that you have with your family. This one is a campus, and it's called a continuing care retirement community, and it has a lot of different levels. You start out 55 and up and very active. Maybe it has a golf course, a tennis court, swimming pool, and it's a fun place for people 55 and up. And as you need more care, they want you to move out of the independent living, the big building there, over to the building at the right, which is assisted living. And you live there as long as you can. And then you might possibly go over here to the left, which would be the nursing facility. And you move through their system based on the needs that you have. So the contracts for these, because you buy into them, you sell your home, put $500,000, or it can go up or down from there, into the community, and that allows you to move through their system when you need more care. It's a nice situation, except they're full and they might have a 10-year waiting list at this point. So do visit a continuing care retirement community in your area. We have some beautiful ones where I live near Hilton Head. So it's a campus, It includes independent apartments or condos purchased with upfront dollars, and it offers all levels of care with additional fees. Different levels of reimbursement upon death of that money that you invested. It could come back to your family. It depends on the contract. The staff includes an activities director, oh yeah, tennis and golf, food services, housekeeping, transportation, nursing aides, RN supervisors, full nursing in the nursing facility, and typically it's Medicaid certified. So if you end up running out of all of your money, you can stay there too. You don't need to move on to somewhere else. They might provide home care. They'll allow home care, certainly, and hospice for terminally ill. National average cost per month is $2,000 to $4,000, but the buy-in can range from $50,000 and you pay as you go, or $1 million and you pay nothing after that. But there's always a monthly fee, and that's called a maintenance fee, and that allows you to stay in this campus. Well, we have Veterans Day coming up in a couple of days, and we want to recognize our veterans and our fallen soldiers. But how many people, a lot of people, think that because they were a veteran, even for 2 years, that the government's going to take care of them for the rest of their lives? And it's not true. With TRICARE or TRICARE for Life, a lot of people will say to me, we have veterans in my community in a couple of air bases. So they think that the government is going to take care of them, but not for extended care. It's a TRICARE is health care, and even TRICARE for Life is health care for retirees. It's medical care. What we do is long-term care, as extended care is not medical. It's the kind of thing you could do for your spouse or your child that they can't do themselves, but it doesn't necessarily mean it's medical. So you can't have any extended care or anybody dropping by through the VA and at home, especially, unless you were injured or wounded or disabled in a specific war at a specific time, certain dates. And the way to find out about that, if you're a veteran, is to go to the website down below, va.gov, and just put in long-term care benefits, and they'll show you there are 8 priority levels of who can get money from the VA and be cared for extended care in a nursing home that is contracting with the VA or a VA facility. And home care is hard to get because it's income and asset based. So maybe you were 100% disabled in a service-connected disability, but you have money. They won't give you anything because they want to serve the indigent. So if you can pay for your care and your spouse's care, they won't offer benefits. So it's limited access in most cities. We don't have a facility here in my community. We'd need to go 25, 45 miles north. Staff is nursing homes. I mean, it's not as much home care, and it includes doctors, of course, and nurses and aides and therapists. Nursing facility care, I told you I'll come back to that, and that's what I want to do right now. There are reasons when people will need a skilled nursing facility for high quality care due to injury or illness that can't be managed by family. So we don't choose to go to a nursing home. I was there as the administrator for over 15 years, and I'm not going back. It's not someplace that I would choose to go. So we built a little cottage on our land, and my husband and I live in 550 square feet. And that's our assisted living. Everything we put in there was thinking that we are not going to move. So we'll be getting home care, and probably expensive home care for quite a while, especially for him right now. But the goal is to go home from a nursing home. It's just to be there maybe for rehab for a few weeks and then go home. So that's always the goal of the rehabilitation therapists too. And most care in a nursing home is not skilled care through Medicare where you have to meet certain qualifications to have Medicare pay for rehabilitation and recovery. But most of the care is extended care. It's about 90%. It's not skilled. It's the kind of care you could get at home, but you now have a reason why you can't be cared for at home or in assisted living. People on low income and assets qualify for Medicaid, and Medicaid wants you in a nursing home. They contract with the local nursing homes, and there's a waiting list too. I checked on Medicaid for my parents, and there was a 1.5-year waiting list, and they couldn't move to be with me and nearby. So you may not be close to your family or your home. It's state administered, and whatever the state can afford to put into Medicaid, which is billions of dollars a year, the federal government will match. But many states like South Carolina, where I am, they didn't even opt into Medicaid the last 2 years. So I don't know what's going to be paying for everybody. But Medicaid doesn't want all of us to go onto their government system. They can't afford that. And we are the ones who are paying for Medicaid through our FICA taxes and our regular taxes, Social Security, so that it'll be there for people who don't have money. Private pay people usually use their own money or their family pays, or they have insurance so that they'll probably never go to a nursing home. It's the last resort, but it could be a choice. It may be that you just don't have any family around to help you, or your friends are gone and now you need more care. So you want to be touring a couple of skilled nursing facilities, as well as a couple of assisted living within 5 to 10 miles of you, because you'll want to drop by every day and see your loved one there and how the care is. I always welcomed people in my nursing homes at 2 a.m. if they wanted to come and see how everybody was being cared for. So you have to have an advocate who's going to be there and make sure that you're getting the right care. For skilled nursing, Medicare will follow you if you've been 3 nights in the hospital under Medicare and you're discharged to a skilled nursing facility. They'll cover you for the first 20 days. And then after that, you have a copay that you'll pay, and Medicare will pick up the difference. But the copays for this year was $194.50 a day. That's still something you need to prepare for. And then they recertify you. If you're not doing really well, they can go 60 days up to 120 days of rehabilitation. But there's 100 days offered for Medicare recipients after you've had at least 3 days in the hospital and now you need to recover. They will offer up to 100 days, but basically nationally they're paying about 21 days. There's just not enough money to go around. The staff are trained professionals, doctors, nurses, aides, food service, housekeeping, therapists, administration, transportation, as well as volunteers. And the average cost of a private room in a skilled nursing is $9,000 a month. That's the average. Now, I work with folks that are up in New Jersey, New York, Massachusetts. It's $11,000 to $13,000 a month. Where would you get that money? You have to think about this and talk about it with your family. What is palliative care? And that's another level that has been developed since hospice came about in the late 70s. And I've been involved in hospice organizations ever since then. And it means to care or relieve someone who's in pain, discomfort, is a difficult person to be cared for by a spouse or family members, but wants to be home, still wants to have treatments. And it's like a cancer patient who just all of a sudden says, I'm done with chemo, I'm done with everything, I'll go on to hospice. Well, this palliative care may mean that you would never go on hospice, or at least it would hold it back for you so that you could still be getting care. And it's great support. It's spiritual support. It is nursing. and nursing assistants, as well as social workers. So it's just a model that's been created that I think is another step toward hospice. It's for people with serious health issues and they need support and their caregivers need it. Improves the quality of life. You get your questions answered and you get the support that you need. The staff includes a doctor or a nurse practitioner, aides, a chaplain, and social worker, and it's associated with a hospice organization. I just put the website of the one I'm on their board, and I like to be sure people understand that hospice is really for the family and to help people transition. And it can really be provided anywhere. Most communities don't have an inpatient hospice building. It's either in the nursing homes or assisted living or at home, or a special if you have a hospice inpatient building. The focus is on comfort and release. No more hospital visits. It's all family centered. Hospitals, independent, anywhere you are, where you're surrounded by family or friends, and it's to help you transition. Inpatient facilities are designed for family comfort too, and ongoing grief support is really important. Having been a funeral director and my mother-in-law was a social worker, she followed every family that we served for a year, because that first year is so tenuous that it's good for you to be able to know that you have grief support groups in your community. Staff members receive specialized end-of-life training, doctors, social workers, aides, homemakers, and there's a lot of volunteers with hospice. Medicare pays all costs for professional care. For the nurse and the aides and the therapists, they will pay, and you don't have to pay out of pocket, but not for someone to sit and hold your hand or be with you and comfort you that it is non-medical. They don't pay for that. And so to think about who will be with me, and if we have to buy people to help me take care of me, who will that be and what agency? We're back to family again. Like I said, it's a family affair to be talking about at the time that I need care or you need care. What are we going to do? And get ahead of it, because it's likely going to happen to somebody that you love. And providers of care are online in your community. If you happen to drive by an assisted living, just check out their website and find out if you can take a tour and have lunch and learn about it. I experience assisted living, a nursing home. I know it's not desirable to go visit nursing homes, but trust me, when you need it, you need to know ahead of time. Ask your friends. If there's a care manager, professional care manager like I am in a community, find out who that is, because you're going to need an advocate. And if your family isn't close by, like Ann and Doug's, they're not here, then she's making all the decisions by herself. And she reached out to me. Your religious leaders, they know the providers of care in your community. An elder law attorney, I recommend that you find one or two in your community. They are professionally trained, specially trained to help you understand if you did run out of money. Do you have to sell your home? When do you do this? When do you transfer money to your children? So they're going to be a great resource for you. And I have a couple of them that I work with here in this area, and they're so responsive and helpful when people have questions. And discharge planners at the hospitals, social workers, they're knowledgeable. You might find a geriatric care manager or social worker in your community. It's kind of like a professional relative. And then Agency on Aging, you can just Google that if you want to, near me, and you'll come up with the Agency on Aging office. And care coordination by professionals is included in most long-term care insurance if you have a policy. So you won't be just on your own, but it's good to know that you have these professionals available to you anytime. You're not alone when you seek help for decisions about care for somebody you cherish or for yourself. our ultimate goal is we all want choices when life-changing events occur to us or to someone we love. We always make big plans for big things like weddings and births and celebrating our grandchildren, buying a new car, buying a new house, remodeling. Big decisions require time. And that's what you might not have if something happens quickly and you have to make these decisions. So maybe this will be helpful. Planning ahead gives you and your family the choices of, it's really for 3 questions. Where do I want to receive my care? Who will be with me? And what will they use for the care that I'll need? So my goal today is to change chaos into calmness for all of us. So I think you'll probably have some questions, and I will toss this back to Dave.
Great. Thank you very much, Nancy. That was, all I can say is, wow. There's a lot there. And look, I'm in the business, and I'm going to tell you, I'm planning on going back to this video to use it as a reference. There's chock full of information. And I hope that everyone listening will do the same, because there's a lot of detail there, a lot of information that, quite frankly, many people are not aware of. Nancy, while we're waiting, and if you do have a question, please click on the Q&A tab on the bottom of your screen that will pop up on your Zoom menu, and feel free to send in a question. But I'll tell you, I really became interested in the area of care when I first met a client who was in her 50s and was a quadriplegic, and she fell in her own home on the stairs and hurt her neck, and as a result was confined to a wheelchair. And I met her husband initially before I met her. Nicest lady, but obviously had her limitations, and he was a caregiver who had a full-time job, so he had to get support at home. And she was in her 50s. And then I met somebody who was in the 40s. Actually, I already knew him, was a friend of mine, who contracted cancer. And unfortunately, he succumbed to the disease. But during those years, his wife and young child at home needed all kinds of levels of support. So I said, oh, it's the 40s. Until I met someone who was 39 and needed a kidney transplant. And obviously going through that whole process, and she survived the transplant, but during that period of time, she needed extra support. And I finished the chain by telling you the story about a 26-year-old woman who I met, who, when I first met her, was saving money. Her goal was to open up a nightclub on a Caribbean island. I can't remember which island it was. And she was saving her money until she got into a car accident. And then the next time I saw her, her father was helping her eat because she couldn't lift the spoon on her own. So it can happen to anyone at any age. So my first question that I'm willing to tee things up with, I love your use of the word chaos, because that's oftentimes when we get the call. I don't know what to do. I got to handle this. To avoid the chaos, at what age should someone start doing their planning?
Well, it's interesting because we were just talking about it yesterday, is that we are finding more parents and grandparents wanting to do this kind of planning for their children and their grandchildren because they took care of their parents. And so typically we're talking about this issue. I see more wrinkled up noses and wrinkled faces under age 40. They're still working on trying to put some money away for retirement, and they may not have all the insurances that they need, and they need to be sure that they have their life going in the right direction. But 40 years old and up, and my daughter grew up in long-term care with me because she was really little when I started working in long-term care administration. And she has no problem. Ever since she's been 20, she's talked about it to her friends. Well, what would we do if we had a major car accident? So I would say 40 probably isn't too early.
Okay. And then the flip side of that coin, should we wait until there's a medical issue to make a decision?
No, That's why I'm saying, if you happen to go by a place that you want to look at, or you talk to somebody who's used a specific home care agency and can make a referral to you. The reason I'm thinking of a building is because our hospice organization just built the first inpatient hospice facility in this whole county. And we are just opened a week ago, and we're full. We've got, full with a waiting list of people who are dying. Yeah, and we knew it would happen, and we can expand, but a week later we need to expand. So I think people are dropping by to just tour it because it's such a pretty building, and it provides a service that we didn't have here.
Well, that's really interesting. A week is all it takes. But I know in the nursing home industry, if you have a good quality nursing home, there's, like you described, there's a waiting list because everybody wants to be at that place, and there's certain nursing homes that you definitely don't want to be at, or you don't want to get assigned to because you have no choice.
I think it's interesting. That's right, David. And I wouldn't have been in that industry if I didn't have a good nursing home. And we were a luxury retirement community. And there's so many regulations for nursing homes that in the lobby, nursing home administrators are required to post for the public to see their last survey from Medicare, Medicaid, from the state health department. And I tell you what, a lot of administrators don't like doing that because they have so many deficiencies for various things that they really shouldn't even be open. And I was always proud to just tack it up there and say we're deficiency free, and the feds came in and we're deficiency free, and the state, and we're going to run it that way. But that takes a lot of staffing. And there just aren't a lot of people going into long-term care for nursing homes. They're doing home care, but not long-term care.
Well, along those lines, we have a question from a listener. There's a lot of discussion right now about the shortage of qualified caregivers throughout the entire industry, both home and institutional. How do we address that?
We happen to have a local community college, and that community college teaches nursing assistants and bachelor's nurses, not RNs, but bachelors. And so we're doing it in the high schools. Actually, you can go to the community college in your junior year, as well as go to high school. So you're done with your training and ready to work when you graduate from high school. And so we really have done a lot with that in our community for nurse retention and nursing assistants. And there's some scholarships and things that we're sponsoring. It's important that we have the nurses that we need. I think over time, most of us are going to be just family taking care of each other, because the population of the older people over 55 is growing so big right now. And the boomers, that we're going to need to be caregivers for each other. We're going to have to figure that out. But not everybody is strong enough to take care of somebody else or wants to. So it is a difficult thing, but I would talk with your community and find out if there's something that you can do, or your organization, maybe your Rotary Club or Kiwanis or something, can support keeping those folks in your community.
And I think a lot of it comes down, like you said before, it comes down to money.
It does.
It's a lot of these caregivers are not well compensated, and like any other industry, if you're not going to pay people, they will find other industries to work in.
Well, and they have to use their own mileage to come to your house. And right now with the gas the way it is, it's a difficult thing.
It is. In thinking about the different types of living arrangements that you've went through, is it better for someone to look at their situation now and say, I want to find a home that I can live in now? Say I'm independent. I want to find a place I can live in independently and move through, like the continuing care communities? Or is it better to think that this is going to be done in phases and find a place Perhaps I started an over 55 community, knowing that down the road I may have to move into one of the other types of residential living.
Well, I think with the continuing care retirement communities, not everyone has a home to sell. Maybe you've been renting for a few years, or you sold your home and you haven't purchased something else. But you need to make a commitment, a financial commitment to that organization. It's privately run, and you want to be sure that the money that you give them and everybody else does is well managed. But some maybe just going down in stages from the bigger house down to the smaller home, the cottage or the apartment, the condo, and still stay independent as long as you can. And then if you don't have the money to buy into a continuing care retirement community, you'll have some money maybe to pay for assisted living, which is rental. And you can go from a 2-bedroom with your spouse and down to a 1-bedroom, down to a studio, or share it, almost like a dorm apartment. So I think just talking about it with your family, so many adult children will say, I'll take care of you. Well, how are you going to take care of me? You don't live here. Are you going to move here? I'm not going to move to where you are. I hear people just put their feet down and say, I'm not going to do that. So without a conversation, you're in the chaos over and over and over again. Long-term care or extended care is chaotic in its best, because you're worried, is the person even going to survive? And if they survive, what's next? And pretty soon it's all about the money. And the families just blow apart. Relationships are ruined, and you don't want that.
Nancy, I can't thank you enough for your presentation today. This has been really tremendous material. And, I always believe that we need to plan, and we need to plan to avoid the chaos. And for so many people, when they hear about long-term care, they think of the money part of it. They think it's all about the insurance, or if someone wants to talk to me about long-term care, they immediately go to, I've already heard about that, and the insurance is too expensive, or don't medically qualify. But the beautiful part of your presentation is, other than mentioning how much these all cost, this is all about care. Yeah, we gotta go figure out the cost part of it. But I know if it were me, I really would want to know about how I'm going to be cared for, and I'd be less concerned about how I'm going to pay for it. Yes, I don't want to leave a debt to my family, but I really would want to know, am I going to end up in one of those nursing homes where the administrator is going to be proud to hang up that survey? Or is it going to be one of them that's going to skirt the rules and maybe keep it buried somewhere where I'm not even going to be able to see it? And perhaps fear for my life in my final days. So I thank you. And I hope everyone who's listening has gained a lot of knowledge out of this as well. With that, I'm going to turn over to Justin, who's going to highlight our upcoming speakers, because we have a lot of good material coming up.
Yes, thank you so much, David, and thank you, Nancy, for joining us today with that knowledge. It being National Long-Term Care Awareness Month here in November was such a timely topic to be able to present to our client base, and so really appreciate what you do for that. And we're continuing on this trend here with webinars and trying to get topics that are of interest to many different people. And so we're going to actually step away from the financial and care realm completely. Next month, we're going to actually be hearing from Julie Roros, who is known as the Ring Woman, and she is a private jeweler, and she will be educating us on kind of all things jewelry and diamonds. So learning about the diamond grading system and all the things. So she's a graduate of Diamonds, GIA, and also helps to create handcrafted custom fine jewelry. And Nancy, she also shares with you, in fact, a vocalist in her background as well. She is in a jazz band and recently had a concert earlier this year that was sold out, and all of the profits actually went to Jewelers for Children as well from that sellout concert. So that was a very fun time. And then our next webinar in January, and by the way, December 7th, it's at noon, is the private jeweler. And then in January, to start off our year 2023 strong, January 4th, again at noon on the Wednesday, we're going to have Dr. Haley Winchell join us for optimizing health and wellness in 2023. So she kind of lives and breathes health and fitness, and she'll help us share her passion in this area and how we can implement strategic health and wellness tactics in our busy lives. So really looking forward to the next two webinar events and hope that you can sign up for those. You can go to our website, personalwealthstrategies.com, click on the events tab, and you'll be able to register for those events. David, do you want to wrap us up?
All right. Well, thank you very much. Thank you, Nancy, once again for an outstanding presentation. For those who are listening to this live, we will have this posted on our YouTube channel in about a week's time, and we'll send you the link. I do recommend that you visit again and take a look at this because there is good material, but please share this with friends. You know, the message I think that Nancy imparted today was plan, discuss these things, do the research up front. Don't wait until the last minute when the chaos starts. So the more we spread that word, the more all of our lives will be that much better. So I thank you again, Nancy, and thank you all for joining us today.